So regarding my previous post, I'm going to show you example of a man who was operated on with extensive kidney cancer, and the hospital allowed a surgeon to operating on essentially a dying man instead of sending the man to hospice care where he could have enjoyed the rest of his life with his family, perhaps taking a paradise trip whatsoever. But the surgeon shortened his life by causing his death. This first slide is I'm going to show you is a slide regarding the findings in the lungs. This next slide is going to show you, and I know you don't see the images here, but I'm just trying to show you that these are the slides where I'll be showing the images from. This is another lung section showing extensive metastatic cancer, even tumor cells within vascular channels with thrombosis and stuff. So you know the man was extremely sick, did not need to be undergoing any kind of surgery. I'm also going to show you another slide with the tumor in the liver. Extensively involved in the liver, and also with various patterns too, by the way, in the liver. And here's the final slide showing the lymph node essentially encased with metastatic renal cell cancer, very matted lymph nodes, and really sad that someone will be operating on a person with this much extensive metastatic disease. But I'm going to show you the slides now just to highlight the histology. I want to highlight to everyone that pathology is the gold. Well, let me say this. Pathology is objectively and definitively the evidence of how medicine and surgical diagnoses are made. And if you don't trust in pathology, you're just listening to someone make money on you and cause even perhaps your life. Wake up, people. Start talking to a pathologist who can assess your risks today to prevent you from dying of advanced cancer like this person here. But I'm going to show you the images now. Listen to me, people. Any pathologist with accurate and adequate skills in pathology can tell you, first of all, this is truly human lung tissue. And if you look at it, the lung anatomy is not that bad. But when you start seeing the areas of hemorrhage and metastatic tumor, is very advanced lung disease, a metastatic disease that's affecting this otherwise anatomically okay lung, but now has tumor causing hemorrhage. You can see some old hemorrhage, and I'll go and show you the closer view. There's evidence of old hemorrhage with the hemosiderin macrophages. There are evidence of recent hemorrhage and so forth and so on. And even at this focus, you can start seeing large blood vessels filling up with tumor. I'll show you to confirm that what I'm saying is not made up, but rather based on science. And so as I continue to peruse around, just to kind of show you at this very low power view, how abnormal, how extensively involved this lung tissue is by metastatic tumor. And so I'm going to start with low power first, kind of give you some, and we're going to really look at this blood vessel basically that is filled up with metastatic tumor. So there's no question about it that there was advanced disease even prior to some surgeon deciding to operate on this very, and those are just bronchial cells, they're very advanced tumor. So let me start back over here to kind of show you the area of hemorrhage, and even both recent hemorrhage and remote hemorrhage as we go down, and we're going to go even closer. And because I don't like to deceive, I like to spread the truth and show the truth. Those are hemosiderin-laden macrophages showing evidence of remote bleeding. So he's been bleeding in his lungs for some time, yet still a surgeon decides to operate on someone who was essentially terminal. But let me keep on perusing around, and you can see some of the areas of recent hemorrhage and some of the alveolar spaces here. You see the extravasated red blood cells. That's evidence of recent hemorrhage or current hemorrhage in the event. And here's a blood vessel showing tumor cells in it. As I go down, not only tumor cells, but it also shows clot. So these are renal cell tumor cells. That's just necrotic tumor and clot material within a blood vessel, within the lumen of a blood vessel. But these are tumor cells from the kidney cancer, metastasized to the lung. And no doubt about that. You can even see some tumor cells having mitotic figures associated with them. So let me go back over to that other side that I told you I was going to show you, that shows a larger blood vessel with tumor essentially encasing the lumen of the blood vessel with steel fiber and clot material. Let me see if I may need to go to a lower power field. And look how clear this is. Any pathologist anywhere around the world, if they got good skills, can show that this is not make-believe. This is not made up. This is true pathology. This is true unadulterated evidence of tumor in a blood vessel. This is all renal cell cancer and extensively involving a blood vessel as I go in and out of focus, just to show you the tumor cells up close. Any person who will want to argue or dispute this would be a fool and should not be practicing pathology. This is metastatic cancer in a blood vessel from renal cell cancer. All tumor cells in a blood vessel. Yet and still, a surgeon in a major hospital in Atlanta was allowed to operate on this dying person instead of allowing him to go home and to hospice care and enjoy the rest of his life with his family, instead of shortening his life through surgery, which he never came off the surgical table from the operation. So let me go back to another view, another area of the, I think it's the lung tissue. So I'm just gonna take this slide off, and we're gonna put in another slide. And keep in mind that this is real-time, real pathology. And you know, the beauty of it is that pathologists anywhere in the globe can read this this histology. It doesn't have to just be Jackson Gates. And that's why I was trying to say in Black History Month, I'm trying to expose that we need to bring quality to people all around the world. Instead of having one pathologist or one group of pathologists read your pathology, you should be trying to promote. Look at this. Blood vessel with papillary and clear cell renal cell, metastatic renal cell carcinoma within vascular lumens. So this is extensive disease. This is not questionable disease. This is extensive metastatic cancer in a patient who was allowed to be operated on while he's dying of cancer. And I had already previously showed the post of the gross examination. Now we're going to go to the liver section. Bear with me as I take this slide off. So this is the liver, again, showing a necrosis, tumor necrosis. And this renal cancer has mixed features of various renal cell morphology, papillary, clear cell, and maybe even some chromophobe in here in areas. So I know with this kind of pattern, this is a metastatic. I'll show you that we're in liver, but right now, if you look at this is all tumor. So we know it may have been some sort of genetic component. You can see some strands of reactive liver cells there to show that this is liver tissue with metastatic cancer in it, a metastatic renal cell in the person who had a diagnosis of renal cell cancer prior to the surgery. In fact, the surgery was to remove both kidneys for the renal cancer, in spite of knowing that this person had extensive disease. So this is the kidney, this is the liver, showing basically you can diagnose the type of kidney cancer that this is. And I'm favoring that this is, well, at this point, it doesn't matter which kind of pattern it is. We know that this is metastatic renal cell carcinoma. I think oftentimes the subtypes is for treatment purposes. And in this case, we don't need to type it. In fact, I was going to correlate the typing with what they got from a ante-mortem standpoint when they did the biopsy. But you can see there's extensive hemorrhage even there with tumor hemorrhage in this liver. With metastatic, and I showed the gross again before. So let me go to the lymph node. Keep extensive tumor. Yet a surgeon playing God, or at least to try to make some money, operated on this terminally ill person. More cancer in a lymph node. I'm going to show you that this is a lymph node as I go. There is some fibrofatty tissue. You see some lymph nodes there. You see tumor in this lymph node. Extensive disease. And look at it. And lymphatics and all over. And here we go back. Here's a large rheumatic lymph nodes again, showing metastatic tumor. Not the metastatic tumor. This is metastatic renal cell cancer with both necrosis, hemorrhage, and extensive disease in a metastatic lymph node. And look at the various patterns here. Just really sad that someone would deceive the family and even the patient that he would be served better to have both his kidneys removed, even though he had extensive advanced metastatic cancer involving not only the liver but also the lungs and the lymph nodes. Just wanted to highlight this point to you. Thank you for viewing this slide with me. And again, go telepathology. If you want quality care and stop the healthcare disparity, then demand open, accountable telepathology viewing of your diagnostic slides. Thank you. This is Black History.